Healthy Wednesdays, brought to you by the sponsors of momseveryday.com.
As weather conditions and seasons change, many of us suffer from sniffles, sneezes, and watery eyes. But what exactly causes these irritations? Dr. Michael Sullivan is here with Allergy, Asthma and Immunology Associates to help us better understand these allergies. Hello, doctor.
Hi, how are you?
Good, nice to have you here.
Thanks for welcoming.
What exactly is pollen count?
Pollen count is a measure of the pollen in the air. We collect pollen on glass slides and we calculate how many pollen grains are there in a cubic meter of air.
I know you'll see it on a weather forecast. They'll say if the pollen count is high or not so high.
Right.
Certain times of the year it's worse, correct?
Yes, trees occur March, April. Grasses pollinate May and June. Weeds pollinate August, September.
And so allergy sufferers have a difficult time in the spring and in the fall.
Yes, ma'am.
What can be done for them?
Lots of things. You can try avoidance, run the air conditioner, close the windows, wash your hair, wash your body after being outside, leave shoes at the door, keep pets outside that bring pollen in. There's a variety of things you can do.
So don't open those windows, huh?
Don't open those windows. Number 2, you can take medications. And number 3, you can take allergy shots.
So a lot of different options available. How common is hay fever?
It's very common. 50% of kids have hay fever. Allergic rhinitis or hay fever is the most common chronic disease of childhood. 20% of adults have allergic rhinitis.
And maybe as a child you never had the problem. Is it, I guess not typical, but does it sometimes happen to adults that they may acquire allergies?
5% of people have onset after age 65, so you can not have it ever and have it begin after age 65, so yes.
What would trigger that?
We don't know.
You don't know?
We don't know why anybody should have allergic rhinitis.
Is some areas of the country more prone to allergies than others?
Some areas are more prone to a certain kind than others. For example, if you're in Denver, high altitude, there's not much house dust mite. If you're in Nebraska, ragweed is a big problem. If you're in a forested area, tree allergy, a big problem.
And sometimes when you move to different areas of the country, you can develop allergies, right?
That's absolutely correct. They vary from region to region.
Tell me what happens when you go do the allergy shots. First they will test you, right? Don't you prick the back?
Typically we prick the back, look for allergic reaction. Those allergens that are identified we use to make up aqueous solution that we give injections into the arm. Allergy shots have been around for 101 years, developed in 1911, and they're very effective. About 80% of folks respond to allergy shots.
So you're building up your resistance.
That's correct, building up your immunity to prevent allergic reactions.
There may be some people out there that say nothing helps me. What do you say to them?
Well, sometimes is the diagnosis correct? Is it really allergy? Because there's certainly an entity called non-allergic rhinitis. Number 2, have they been on appropriate medical therapy? So typically, is the diagnosis correct and is the therapy correct?
So really they just need to come and see you and make sure.
Probably.
Okay, well thank you, doctor, for that information.
Thank you, ma'am.
Appreciate it. And for more information on pollen count and hay fever, log on to momseveryday.com, find the health button, and click on the Allergy, Asthma and Immunology Associates page.
Moms Every Day, weekdays at 8:55 a.m. is brought to you by the sponsors of momseveryday.com.